Be- We should begin our meeting. Welcome everybody to the Incarceration Prevention and Reduction Task Force and the Law and Justice Council meeting for January 12th, 2026. Heather Flaherty and I are co-chairs of this fine group of people, and we are thankful you're here. I'll begin the meeting with the land acknowledgement statement. Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders, past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events. Well, welcome. I have been asked to make a few announcements. Is Deborah Hawley here today? This is her last meeting, and I wanted to thank her for her participation and wish her well. And Jill, what position is it that she holds? And do we have a process for finding someone to replace Deborah?
Deborah is serving in the position for someone with lived-in experience as a person or family member. And yes, there are many advisory committees who have terms ending, and so there's been a process, an annual process for that.
Okay,
Peter,
great.
Deborah just joined. Deborah just joined.
Oh, hi,
We're
Deborah.
we're
Can
celebrating
we?
you.
Yes, we are. Deborah, can you, if you like to say anything, we are thanking you for your service to this task force, and just wondered if you have anything you'd like to say in your in parting.
You're muted, Deborah.
You can tell I haven't been at the meetings for a while. I can't even navigate the mute button. Yeah, I actually did have something to say. I was just kind of reflecting on things yesterday. Oh, first of all, I want to say that I'm sorry that I've been absent for a lot of the meetings for a while now because we moved and it was kind of a big move to another place on the island. And I don't know, things got a little disoriented. So haven't been around for a while, but I'm glad to be here at this last meeting. Let's see here. What I wanted to share is on my phone here. Um, Hang on one second. Okay. So I just have a few notes written here. So thanks for the privilege for having me serve on the task force for the last 2 terms as a consumer representing someone who has an incarcerated loved one. As far as the prevention and reduction of incarceration, I tend to lean towards the prevention side of it. And I studied systems theory at Antioch University in my last graduate program. I don't know, it was about 15 years ago when I graduated. And I was looking at studying systems theory and my area of interest in being raising public awareness about mass incarceration in the United States and learned how to create conditions for change and so on. And so, one of the things that came to mind based on my own personal experience with my son, a little bit with my other son, but was that the problems started well before, well, just deal with my oldest son, well before he started his incarceration. And I was in Ferndale yesterday and thinking about, this being my last meeting, and I decided to go over to the place where my son was first arrested and incarcerated for a crime at the age of 16. So I drove over to that place and I sat in the parking lot and remembered he's 42 now. Sorry. And I was thinking about his arrest on his 16th birthday in the parking lot there. Anyway, okay. So he was taken into Whatcom County Juvenile Detention. And, I sat there and I thought about, God, what could have been different? He's serving his fourth prison sentence now and he's 42. And this whole issue of prevention is such a complex issue, and there's, a lot of different variables that go into it. But um, I just sat there and thought, what could be different? And I was refreshing my mind on, I won't take too long with this, on statistics of juvenile incarceration and the relationship between that and later adult incarceration. And approximately 70% of kids that are in juvenile systems incarcerated will go on to uh, be in an adult facility. And so I think that there needs to be um, an emphasis on some kind of communication, some kind of system rather, between the juvenile detention and the jail. Yeah, I think I'll stop there. Oh, wait, I did want to say one more thing. There's a very high percentage of juveniles who are incarcerated who have a diagnosed mental illness, and it's around 70%. Do any of you have any questions or comments?
Peter, I'd love to share some things.
Oh, absolutely. Please go ahead, Heather.
Deborah, I just want to say truly thank you. I have watched you for 8 years now, and every single time you have shared in this meeting or in community meetings, it is impactful. And what you just shared is so tremendous and courageous. And I know personally, I can feel and wonder, does any of this add up to anything? All of this showing up and sharing. And I want you to know that your insights have absolutely shaped what the policies are in Whatcom County, what the opportunities are. And I just have immense gratitude for you sharing what you even shared this morning as your parting words for us. And I think that's something that our task force should think more about. I'm not sure, Jill, you can check me if I'm wrong, but we don't have a lot of juvenile representation on this task force. I don't think we have anyone from the juvenile court or detention. And I know we've tried to round out the prevention side, but thinking about like how far back do you go? Like you said, Deborah, it's so many variables and so many systems. And so I really just want to say, I hope you find ways to stay connected. I'd love to. Congrats on your move, and please continue to participate and in however you want to, because the wisdom that you have to share is some of the most important wisdom that we've had the privilege of hearing. So thank you for
Oh my
your
gosh,
years. Truly, thank you for your years of service, and please stay connected to us.
I definitely will. Thank you so much.
Yeah.
Would anybody else like to say anything? Well, it'll be important for us to fill Deborah's shoes, and let's make sure we do so right away. All right, the other announcement is, and thank you, Deborah, from all of us.
Yeah.
Uh, The other announcement is there's a reminder that our next meeting is our annual committee elections for all IPRTF members and the IPRTF co-chairs. I can't believe it, but Heather and I are finishing our first term. Okay, great. Let's move on to the next item, and that is confirmation of appointment to the JAW, the Justice Advisory Work Group, and I'm going to turn it over to Barry to do this. Hello, Barry.
Morning,
Good
everybody.
morning.
How's everybody doing? Hope you had a great weekend and a good time with your family this past few weeks. So we're here to talk about the jaw, and I want to bring something up that, we've been talking about for a little bit behind the scenes, and that is, I know both of our co-chairs are very interested in being on the jaw, and I'm prepared to make that recommendation today and nominate both of our co-chairs. But I understand that there's some concerns about some quorum issues, so I wanted to get that out and have that conversation first. And I think, Kayla, you're the one that I believe mentioned that to begin with. So I'd like to ask you, give you the floor.
Yeah, thanks, Councilmember Buchanan. So so the executive has asked to create sort of a work group, which is it's actually a shared committee of representatives of the Finance and Facility Advisory Board and the Whatcom County Council in order to have some folks preview information, suggest what questions we should be asking related to the jail scoping exercise. We don't have the staff to capacity to have each of these meetings be an open public meeting. And so in terms of clerking, minutes, packets, all of that. And so what we're trying to do is have this just essentially be a joint work group that would preview information that would eventually be viewed by the FAB and the County Council in open public meetings. And so again, this is essentially a committee of the Finance and Facility Advisory Board, and we would like to avoid quorum issues with the Finance and Facility Advisory Board and also make sure we have a diverse membership. So we've asked for one of the two IPRTF representatives on that board to participate in this committee. Just like we don't have all council members participating or all mayors, we're trying to get a broad representation from each of the decision-making and policy bodies affected here.
Okay, thanks. Any comments to that? I know. What about if there was a rotating basis? I know they both bring different perspectives to the table, and that's why I'm so interested in having them both participate. Is there a way to have them rotate if that was amenable to them?
That wouldn't be kind of putting me on the spot here. That wouldn't be my preferred approach. This is going to be fast-paced, highly detailed information, and the continuity of the membership would be helpful.
Heather?
Maybe everybody else is up to speed, but could we just give a quick overview? I know you shared a thumbnail, but what is the Joint Advisory Work Group going to be tackling? How will it be connected to the IPRTF, JPOP, FAB, County Council? And then is it an actual quorum issue to have both co-chairs of the IPRTF participate, or is it a preference? So maybe just because today the ask of the IPRTF is to appoint representation from IPRTF to the Joint Advisory Work Group. Is that right?
It says confirm, so I'm not
Confirm.
exactly sure what that means, but
Okay.
Yeah.
So it'd be great just for the community record. What is the JAW and what's it going to tackle? How long will it be meeting? How does it work with the other groups? Just briefly. And then the quorum question.
It's a work group intended to inform the Finance and Facility Advisory Board related to the scope of the jail construction project. So essentially how we will review different, we're working on this validation phase of different scenarios for the project. And so we will This group will be the group that receives the initial scenario information, so they can ask questions about that. So when we go to share that information with the Finance and Facility Advisory Board, we're prepared with information to answer those questions. So they'll see, a scenario that shows things around the number of beds in the jail, the number, how specialized housing is configured, supervision model, that kind of stuff. And they will have the first look at information, but this is information that would be shared, 2 weeks later in a Finance and Facility Advisory Board meeting. And then I believe it is an actual quorum issue. I wasn't expecting this, so I'm just trying to find my documents with the jail membership, but I believe we risk a quorum issue if too many people from the Finance and Facility Advisory Board participate.
Got it. Okay, that's helpful. Okay. I wonder what the IPRTF would think about am I allowed to make a motion, Jill?
Yes.
Okay. If I made a motion to confirm Peter Fraser's appointment to the Joint Advisory Work Group on behalf of the IPRTF and pending, if it's not a true quorum issue, that I could also participate in those meetings. And if it is a quorum issue, then Peter will be the primary representative for IPRTF. Dan?
Is that your motion?
Yeah,
Okay, I'll second it.
thanks. Any further discussion or questions? I see, is there a conference room? Peter, do you want to?
Yeah, I just want to let everyone know that you and I talked last week about this issue, and I am dedicated to, if I am the sole representative, I want you informed, and we'll make sure that I do so that we have both our perspectives represented and you being in the loop.
Appreciate that. Thank you. And that goes for everyone here as well. There's no, I think there's no secrets. It's just a lot more meetings and a lot more discussion than the IPRTF can have with our structure. So, okay. Any other questions or discussion? I see Mayor Lund.
I just wanted to share that the city has one lone representative to this advisory group. Forrest Longman has been selected, and I know Councilmember Lilliquist. I think it's a reduction in size. So in order to go as deep as this board plans to go, I think they're keeping it as small as possible. And that does limit, like, my voice won't be represented there either. And I just wanted to acknowledge that it is a subset of the many perspectives and voices on this group. So
Thank you, Maryland. That's great perspective to add. Thank you. Do people feel ready to vote to confirm Co-Chair Peter Fraser to the Joint Advisory Work Group? All in favor, can you raise your hand with the Zoom function so Jill can count?
Actually, the Zoom function doesn't record raised hands. If you could activate your video and wave your vote, that would be really helpful. Thank you.
Thanks, Jill. Yay! Happy New Year wave too. Good to see everybody's faces.
Thank you, everyone.
Anybody oppose? I don't think Sat Paul and Eric's hands are supposed to be up, but come off screen if you oppose. Great. And any abstentions? Okay, motion carries. Thank you. Our next agenda item, I see. Oh, go ahead. Executives to do.
Yes, sorry.
Sorry, that was the old one. Thank you.
Okay, take it away, Peter.
Okay, let's see. So we're going to have our quarterly report from Kayla, you and I did not get a chance to talk about this beforehand, but why don't we talk about the behavioral care center as well as when you're done with that report?
That sounds great.
Okay,
Thanks,
thank
Peter.
you. Take it away.
Okay, great. So I don't have a PowerPoint presentation, but I believe everyone got this quarterly report emailed to them over Friday or over the weekend. Can you see my screen?
Yes, we can.
Yes. Okay, great. Thanks. So I'm just gonna go, I'm not gonna talk at length because I'd rather reserve my time to talk about the behavioral care center. So I'm just gonna highlight the interesting stuff on the most interesting stuff here where we've had some major updates. So we are on the increasing access to behavioral health services and addressing workforce shortages. Melora is online and may be able to answer questions about this, but the health department initiated a survey from professionals in the behavioral health and corrections field to talk about sort of barriers and capacity constraints. They're working on analyzing that information and then are going to provide that publicly sometime this quarter. So you could expect to see more from that soon. We, on the sort of increasing capacity of diversion programs front, I know Melora is working on some evaluation of our state-funded diversion programs, which I'm sure she'd be happy to speak to. And then we, as part of the jail, I'm looking at the wrong, I need to move my camera to my other screen so I'm making better eye contact as I'm reading. We are also working on a sort of diversion study as a follow-up to the jail capacity analysis. We're working with a statistician who our jail project managers have found to help us sort of anticipate the effectiveness that the behavioral care center and other diversion efforts could have on jail capacity. I think that's sort of the extra oomph that everyone's been looking for. So we hope to have that wrapped up in the next couple of months to inform these scoping decisions around the jail project. So more to come on that soon. I'm going to continue to touch briefly just here on our capital projects. As you know, we were prepared to build a crisis relief center, got money from the state, and then hit pause because we are very concerned about operational issues. There was recently an article in the Seattle Times about some of these struggles that these crisis relief centers are having, and we are not going to make the same mistake that other communities have here. And we don't want an empty facility or a facility we cannot afford to operate. So we are pivoting and trying to co-locate some crisis relief or psychiatric urgent care services within the behavioral care center, which would also have a co-occurring inpatient treatment license to make those facilities more sustainable. And then our big ask over the next couple of months and the big push we're trying to work on is to make sure our legislators hear from us that we are interested in having more flexibility for the use of our crisis relief center capital budget appropriation so that can be applied to sort of this hybrid facility. So if your agency is interested in chatting with us about that legislative request, please reach out to our office, and we certainly could use some help there, but wanted to make sure it's really coordinated so we can get you our working papers and other things we're using to inform that request. On the capital project side, we are moving right along, and it is going to be a busy few months. I think people are always asking me, like, when are decisions going to be made on sort of jail size, jail's budget, those sort of things? How do we make sure we're not missing that opportunity? I am telling you that the next few months will be critical. We are going to start debuting information probably mid-February in public meetings. And then we'll be working with the Finance and Facility Board and the County Council, as well as the cities and this group to get through decisions by sort of, I'm forgetting the exact timeline here, but we're trying to, by midsummer, really have direction so we can begin the design phase in earnest. I'm happy to come share information with this board, but it is also going to be very, very busy for us and our project team during this phase. And so I'd like to channel conversations as much as possible into the Finance and Facility Advisory Board, which is really charged with making recommendations on these types of decisions. So I can work with Peter and Heather on trying to figure out what the best way to sort of engage with the IPRTF throughout this process is. Just in terms of some milestones, we hosted a great community engagement workshop in Ferndale. This winter, we had over 100 members of the public. Riley Sweeney in our office, I just want to give a special shout out to him. He organized that, and it was a great debut of information, and we're hoping to do a couple of more of these in different iterations. And then also Council Member Buchanan, the sheriff, and our IPRTF co-chairs were really involved with that as well. So I talked a little bit about how we're working on scenario development, and then we're also spending a lot of time on sort of the boring environmental stuff. Not environmental boring, but just like the behind the scenes stuff that haven't been as much of a matter of the public focus, but is a major driver of our project schedule. So like engineering work, geotechnical work, wetlands mitigation work, all of that is our ongoing and taking a lot of time from our project team. In terms of additional facilities that we want to sort of build over the next several years, once we're through this major project, that is a component of the Justice Project implementation plan, is to sort of have process around those prioritizations. I think I've said before, I really look to the IPRTF to inform some of that prioritization work. But just to start, some of the work we're doing with our behavioral health consultant on the jail project and our health department will inform some of those next steps. So as we think about building out the Division Street campus, as we think about what gaps we'll have after the construction of the behavioral care center, what does that look like? And so we'll hope to have some preliminary information soon. I also just want to know on some of the other projects here, a big area where we're hearing some attention and concern is around reentry services. Increasing reentry capacity was one of the main focuses of the Justice Project implementation plan, and it is really connected to how we run our jail medical services. We've recently had a change in that provider. Our longstanding provider decided to depart. We're working with a new provider, and the model of reentry services is more focused on sort of medical care coordination as well as pre-release reentry, as opposed to case management post-release. So the sheriff's office, the health department, others stakeholders are sort of thinking about what that looks like going forward, assessing whether that capacity needs to be augmented with community-based services, and if so, how we would fund that. So happy to answer questions there, but if we want some specialized focus on that conversation, we should probably schedule some time because it's complicated. And then just the only other thing I would say is that the supportive housing stuff coming out of HUD is concerning and will certainly impact our local housing plans. And so we are trying to figure out sort of how funding could move around if we lose some of the funding that we have traditionally received for shelter plus care and supportive housing programs as HUD moves away from housing first models. So could I think a lot of that discussion is happening at our Housing Advisory Board, Homeless Coalition, other meetings sort of outside the view of this committee, but just want to make you all aware that work is happening. And then just also share that we, I believe, have received a draft contract from the Seattle Foundation for our large True Blood housing grant that our health department worked on. And so they are working through those details in partnership with Lake Whatcom Treatment Center and others. And we are really excited that outside money is going to support the development of some supportive housing for justice involved folks and True Blood class members. So happy to answer questions, but that feels like a really big win, over the last year I believe. Melora, can you correct me if I'm wrong? Is it $3.6 million, the grant? Does that sound right to you?
Yes, that does.
Okay. Any questions before I launch into sort of a deeper dive on the behavioral care center?
I have a question. Peter, did you?
Oh, I was just going to call for questions. I've got one, but didn't want to go first. Barry, go ahead.
So Kayla and Executive Sadhu, I have a question for you. Executive Sadhu mentioned at the Finance and Facility meeting last week that there's a potential state review process that may take a lot longer than what we were hoping for. And I just wondered if we could inform this group a little bit about what's going on with that.
Yeah, thanks for the question, Councilmember Buchanan. We don't have much more to share. I'm not sure that
Well, this group hasn't heard anything, so.
Yeah, I think I would, we're meeting with our project managers this afternoon. So I think that process is built into our schedule already. We're just saying everyone needs to be aware of what that schedule is, and that there will be a period of time where we are in environmental permitting with ecology. Once it is in their hands, that we have very sort of little control, but we're not trying to sort of activate yet. We are still working on a strategy, and again, want to make sure we get some information from our project managers before we talk too much. Don't want to put ecology in the hot seat quite yet. Paul, I don't know if you want to say anything else.
Doesn't look like it. Thank you, Barry. Heather, go ahead.
I'm curious about your update on working with a statistician on the it sounded like discernment around diversion programs and potential facility needs in the future and the impact on jail beds. Am I connecting the right dots? I'm curious about, can you share more about who internally at the county is on like point person for that work? And is anyone from the IPRTF connected to it? Because I think it's very aligned with some of the goals, obviously, of IPRTF too. So
yeah, Hannah Fisk is our point person for the county. They have active ongoing meetings with some behavioral health treatment providers who are involved in that work, some of who may be members of this committee, but I'm not entirely sure. And then our project team are experts, but I thought we would sort of, once that work is in draft form, bring it to the IPRTF for some review and consultation. And I will make sure that our project management team has that on their radar as well.
thank you.
Thank you, Kayla and Heather. Yeah, we're very interested in that and would love to see it as soon as it's ready for us to read. Mayor Lund, please go ahead.
This is less of a question, but I just wanted to share. I'm going to have to drop off the call, but it's adjacent to strategy 3 about the needed facilities. And I want to make sure everybody is informed that the city has as a top priority for 2026 is to find a location and bring online a day shelter. And what is accelerating this is that this fall, winter, the downtown library will be closed, and the important de facto role that facility plays in meeting day sheltering needs. And our community will be in a crisis if we don't have an alternative. So we're going to be forming a committee. They'll be meeting every 2 weeks. It's kind of a sprint that we're in to get this facility online. And we're touring a facility on Wednesday. So word might get out about how quickly we're moving, but I just wanted to share that we're working as fast as we can to meet this critical need before the library closes for renovations.
Mayor Lund, thank you so much for bringing that up. I have been concerned as a weekly user of the downtown library. I recognize its importance to the population that is a vulnerable population, and without the downtown library, I was wondering where people would go. So thank you so much. Appreciate that. I have a question for you, Kayla. Or rather, maybe it's a statement. I have been having some conversations and concerns around the subject you brought up earlier around the new contractor in the jail, medical contractor in the jail, and what it's going to mean for behavioral health in the jail and reentry. And it's my hope that we could get a presentation to this body just as soon as possible so that we can understand what the consequences, directions, changes that we're going to have. So is that something we should arrange with your office, or whose office should we? arrange a
sheriff.
presentation? The sheriff. Okay. All right. Very good. Let's we'll make sure to do so. Thank you. All right. Any other questions on the executive's quarterly report before we move on? All right. Thank you. Go ahead, Kayla.
Okay, sorry, I'm sharing my screen again, and I'm going to do like a presentation hodgepodge here. I'm just going to show some select slides from presentations we've shared with the council. So if it gets too confusing, just let me know. Anyways, so as everyone knows, we're working on the Behavioral Care Center. I shared a little bit about where we're at with this in terms of our legislative advocacy, as well as some of the scoping with this behavioral health analysis we're working on. We need to make some final decisions on certain things over the next month in order to proceed with the project. And I wanted to highlight those big decision points to give this group awareness of them, as well as an opportunity to weigh in over the next couple of weeks if you want. So the Behavioral Care Center is essentially a diversion facility that will be used for pre-arrest diversion in terms of like immediate client intake and referral, as well as diversion further downstream, essentially offering treatment in lieu of incarceration to folks. The two sort of hot button decisions about this facility have been whether this facility should be in or out of custody. So is this an incarceral facility or is this a treatment facility? And then the second decision is where should this facility be located? Should it be located adjacent to the jail on the LaBounty property, or should it be located adjacent to other behavioral health treatment options on the Division Street campus? So none of this was really hashed out in the Justice Project implementation plan, which is why we are here now trying to make these final decisions so our project team can proceed. Peter convened a work group called the Behavioral Care Center Work Group. I'm like not sure which slide I'm showing here. Are you looking at what looks like a PowerPoint presentation with the members?
Yes, we are, and it's we're looking at the list of participants is centered.
That was my intention. Okay.
Okay.
So anyways, so they this group of folks that you see on the screen, a diverse sort of group of folks from the criminal justice sector as well as health, looked at these two major questions over the period of 6 months in 2025. This here shows sort of some of the work they did during that period to inform their final recommendation. This group then sort of thought through different policy factors affecting these two questions and coalesced around the shared vision you see here on this screen, which is really to provide an effective alternative to incarceration for folks suffering from behavioral health conditions, and then divert folks away from our criminal justice system, while also being conscious of trying to leverage outside funding through Medicaid and private insurance. They worked through those types of issues. They worked through different on-ramps in the criminal legal process, and eventually went sort of to do some public presentations on these issues and their recommendations. You can see listed here some of the presentations they gave in 2025. All those on the right are the community presentations about the Behavioral Care Center. And then we are sort of have identified these next steps around doing a construction cost analysis at the two locations, which I'll show you momentarily. This ongoing work around operational cost analysis, which is ongoing and not complete. And then this advocacy to make sure we're utilizing that crisis relief money for this facility, if at all possible. And then, so after that group finished convening their work, they essentially said, we are recommending that this facility be a out of custody facility. So this is a healthcare treatment facility, not an incarceral facility. And the group also recommended that this project be sited on the Division Street campus to allow for better pre-arrest diversion, more upstream intervention, and also continuity of care and referral with other behavioral health services that are located at the Ann Deacon Center of Hope. There was some concern, particularly from the public defender's office, around transportation from folks who were getting released from jail after booking and sent to this facility. The health department brought up sort of parallel concerns the other way. If this facility was sited at La Bounty, would there be transportation issues sort of upstream getting folks over to that jail site? But ultimately, the recommendation out of that work group was to site at the Division Street campus. We went to the Finance and Facility Advisory Board and County Council to talk about some of these questions. The Finance and Facility Advisory Board concurred that this should be an out of custody model, but sort of has not yet made a decision or on recommending a location. And we're having some parallel discussions with the County Council as well. So the information, this group's seen a lot of that information I just shared. I just wanted to do a little bit of a refresher, but the information you may not have seen is related to the 3 location options and a little bit of a deeper dive. So I want to share that with you today. I'm not necessarily asking for a decision point or a recommendation. I just want the group to have awareness because it is likely that in the next couple of weeks, we are going to be asking the County Council to make a decision on this. And then the Finance and Facility Advisory Board is going to hold a special meeting in January also to talk about this issue. So let me share screens here. This presentation was created by our design builder and construction project manager. So like, I'm not going to be able to cover everything in here because it's a little outside my expertise, but I'm going to do my best to give you the main policy highlights. So we took 3 sites for the behavioral care center. You do not need to read all this level of detail here. I'm just using this sort of as a presentation tool. And we looked at 3 sites. The first site we looked at was repurposing the work center once it is vacated as the behavioral care center. The second site we looked at was 2000 Division Street, which is essentially a vacant parcel we own on Division Street where we were planning to build the crisis relief center and looking for that as a new construction opportunity for this facility. And then the third site or option we looked at was new construction at La Bounty. So the first site, the work center release. The main sort of value here is sort of infrastructures in place, right? Like the facility is serviced with sewer, water, all of those sorts of things. It has parking, and it is an existing facility, which is supposed to result in some cost savings. It also has, of course, this proximity to the Ann Deacon Center of Hope, which is helpful from a continuity of service standpoint. The cons on the work center location is that it's not like a beautiful site. There's not a lot of landscape buffer, and it is a sort of industrial character building and has the stigma of being the former work center. It also constrains future expansion possibilities, potentially could lead to the relocation of the Digwallick Center that is providing outpatient services there. And the main con is that the project could not start construction on the remodel of this facility until the new jail is completed and this facility is vacated. So there would be a delay in the opening of the behavioral care center if this option is selected. I'm not going to go into like the site plan stuff. I don't think we need to talk at length about that. But if folks want to email me or have questions, happy to provide more information. The second site is new construction at Division Street. This allows us to build a healthcare facility from the ground up. We're not sort of tied to this industrial building that has this community stigma attached to it. It's a little bit of a small site for the facility we're trying to build here. Things might be a little squished looking at Ann Deacon Center of Hope. Not great, sort of beautiful landscaping or anything like that, but we would do our best here. We could use wood frame construction for cost savings here. And it just we can design a more therapeutic looking building essentially. That has higher potential cost than this repurposing of the work center, has some wetlands on the site, and mostly just the shape of the site is not ideal for how we want to build all of these rooms with natural light on the outside, but we're convinced that it can be done. The third site, La Bounty, this sort of gives us the biggest space. It is on a large site, allows for lots of natural light and buffering. We don't have to have the same architectural character of this building as we would for the new jail. but this site has a lot of high development costs. We'd have to, deal with utilities. There's also wetlands on this site. Of course, we're concerned about stigma being attached to the jail. But mostly sort of we'd have to fit this on the right part of the site to deal with these wetlands and other issues that we're facing, but it's all possible here. So I was going to show you the cost differential, and this is like real high level. These aren't our actual costs. We just did this for the purposes of aiding decision making. But you can see here that there's some cost differential between these sites. The work center repurpose, we're thinking the total construction costs could end up anywhere between 22 and 26 million. Again, this is a guess. The new construction at Division Street, 29 to 34 million dollars, and La Bounty, 29 to 36 million dollars. So work center is a possibly cheaper option, though you never know. Once you get in there and start opening up an old building that wasn't designed for this, anything is possible. Our construction team has bets on whether or not we'd actually realize those cost savings there or not. But yeah, like the main advantage of that work center option is really potential cost savings. And then on the new construction side at Division and La Bounty, you're really looking at similar costs, slightly higher at La Bounty, but I think sort of the main decision point between those two sites is really around policy. Like, do you want this facility located near other behavioral health treatment facilities, or do you want this facility located near the jail? So those are the main decision points we are facing on this facility to proceed with scoping. Happy to answer any questions. Just want everyone, again, to know that we are reaching decision points on this. And so, yeah, if you want to weigh in, now's the time.
All right. Chief Herzig, go ahead.
Thank you, Kayla. I was just going to ask if there's other unseen cost savings in facilities that might be utilized by both behavioral care and the jail, such as a pharmacy, or things that both of those buildings are going to need, but maybe that's not worked into the total cost because they're both using it. If there's opportunities for that at all.
Yeah, we've thought about that a little bit. And Melora, chime in if you disagree with me. I think there's more likely for healthcare cost efficiencies on the Division Street campus than on the jail campus. Like the jail health provider is very specific. Like they're not billing insurance. They have their own pharmacy. It's all contained within the jail. You're not going to necessarily have the same, they're a correctional healthcare provider. They're not necessarily going to be providing community-based healthcare services the way a licensed behavioral health treatment agency would be. Whereas on the Division Street campus, right, we have behavioral health treatment agencies, which is different than a correctional healthcare license. So if the facility is out of custody, I think there's more likely there'd be shared services between those facilities. Melora, if you have any different perspective, please chime in. But I think we're thinking the cost efficiencies would be greater from a healthcare delivery standpoint at Division.
That's helpful. Thank you.
Mm-hmm.
Councilman Hamel, go ahead.
Yeah, thanks for the presentation, Kayla. You touched on it sort of near the top of your remarks regarding the work center repurposing. You had mentioned Digwalich and a potential role that they may play. I'm just wondering to what extent those conversations have proceeded forward, or if that's just kind of, just where that's like more of a check-in at this point.
Yeah, it was mostly about their existing services. We don't want to like take over the whole building without sort of notice to partners who are operating in those facilities. But in terms of who's going to be the treatment provider for this facility, we will proceed with some sort of request for proposals once we have the services scoped.
Dan, your hand is still up. Are you?
Yeah, I just put it back up. Yeah, no, I should clarify. My understanding was that Digwalich had we had very, very early conversations that there could be an opportunity to repurpose part of the work center for a clinic that would be similar to the Digwalich clinic off of Highway 20 that would provide community-based services, including a pharmacy, to the chief's point, including perhaps dental services, medical services, and counseling services. So this would be a separate operation from the behavioral care center. So I just want to make sure that that's out there, that we're talking about two different things here, and I just wanted to the group to understand that, and also Caleb, if you had any observations or any other information, that'd be helpful. Thanks.
I don't have any information that's sort of those conversations. I'm not aware of sort of the county's role in those conversations, but you know, certainly always happy to be talking to partners about treatment and healthcare access expansion. But I don't believe those conversations around that creating a larger clinic, certainly not in my view, happening in sort of my frame of view right now.
All right, thank you, Dan. Heather, go ahead.
I continue to really think deeply about the opportunities, and I just want to, for the IPRTF, for the discussion, for all of you to weigh in. The original concept, and Peter, you've been a part of this journey. You went on all the trips, and Barry, you too. And Tank, you went on some of those too, I think, and maybe Eric. But the original idea was to have behavioral care within incarceration, because we understand and see so many people that end up in our jail need treatment, they need care. And then just the path of how we came to outside of the jail, some of that is reimbursement related, that we can't bill insurance for people who are incarcerated. And so there's a more sustainable operation if we can provide care outside of the jail. And in many ways, I thought that would be a win for the community, because there's a value in me of you should not have to be incarcerated in order to receive treatment. And so if we have a behavioral care center that is out of custody, theoretically, that would be available to anybody in the community that needs behavioral health care or substance use treatment. It would be designed as a co-occurring ability, right? I'm tracking correctly so far. I'm looking at Melora especially. So
I'm always looking at Melora to nod along with what I'm saying.
Right. So I just want to share that path for people to remember how we got to this. And Kayla, thank you so much for the details around the trade-offs of each site. I think to delay the opening of the behavioral care center, to have to wait for the jail and to move people from the work center to a new jail and then start building, I think that would be devastating for the community. I really think that symbolically that would be a loss, and also for the actual care and need that we see in the community, that would also be a loss. I think the behavioral care center should be opened first. And but I do still worry. My one worry is, and I'm grateful for the prosecutor's office, right? They wrote the memo saying, we will commit to prosecutorial diversion, because that out of custody, in custody piece is really, really important. And so the prosecutor's willingness to maximize diversion for so many of those people in our jail who need treatment and would not be committing crimes otherwise if they had the support and treatment and housing often. But the condition they put forth with agreeing to that model is that inside the jail, treatment would also be available. And my worry is I just don't have the depth of understanding around the difference in corrections health versus traditional healthcare system health. And I'll share one anecdote that I remember from a couple of years ago, that I think Chief Wendy at the time shared. There were concerns about the transitions of inmates from Western State Hospital back to the jail for competency issues, and that the medications that they needed, they were able to receive at Western State, but not in the Whatcom County Jail, because our corrections health and the design of the jail wasn't set up to safely administer the right medication. And so then sometimes people would decompensate again. And I have concern because of our anecdotes like that how do we make sure that inside the jail has robust treatment as well? And is that something that the Joint Advisory Work Group will be weighing in on, because that's like, I just think that should not be acceptable to say we can't give you the right medication because our staff isn't, or our design or whatever the barriers were, right? So I just want to share that and invite any more conversation if this is our chance to weigh in conceptually.
Thank you, Heather. Kent, go ahead.
Yeah, so I think we need to really think of the jail in terms of, let's imagine that we weren't building a behavioral care center. And what are the services that we'll provide inside the jail? And with those services, what's the goal of those services? So, of course, um, I want to build a behavioral care center. I think the community does. I would probably, I think we all agree that probably everyone on this call and others want to build a behavior care center. But also, one of my goals with the new jail is to make sure that we have sufficient services within the jail, Heather, to ensure that a person doesn't have to be released just to go to the behavioral care center or to the Ann Deacon Center for Hope or to other places to receive that treatment. Now, I think the question is going to be the level of treatment. They might be at some point released and go to those other places for extended treatment, um, which would at that time be voluntary treatment because it won't be in custody treatment. So our goal is to make sure that within the jail itself, within the new jail, that we have those services available.
All right, thank you, Sheriff. Eric Ritchie.
Yeah,
Prosecutor
thanks.
Ritchie, please go ahead.
Great, thank you. Yeah, so I just wanted to add on to what Heather said. Having some treatment within the jail was part of our plan. We talked about that originally when we were talking about the Nashville model. We all were arguing strongly that this is what we wanted to see in our community. We wanted to see treatment within the jail and divert people that way. We gave up on that, understanding costs. We understood that we would be building an out-of-custody behavioral care center, and that was making a lot of sense to us based on cost, based on how we would receive Medicare dollars and things like that. And we agreed to divert people using that system. But that was all with the backdrop that we would be getting some treatment within the jail, which is so important. It's something that we need. We know that some people won't be released, and those people still need treatment. And I'm encouraging everyone to support that plan. Thank you.
Very good. Thank you, Prosecutor Ritchie. Raylene, please go ahead.
Thank you. I'm torn because I see the pros and cons on both sides. I feel like it's best to have it at the jail, but I also understand the cost and the restraints. I think there is enhanced safety and security having it next to the jail. I think there's cost savings in transportation. Even if we're constructing it at one place, we're still going to have to pay for the transportation and the deputies to do transport. We're having some other secure way of transport, which I think could be challenging. And so over long term, is that transportation actually going to be more costly than having it at the other facility? Increased in efficiency and timeliness. I've seen a lot of people falling through the cracks when you don't have stuff co-located in the same buildings. And I think it also limits public exposure when you're transporting people back and forth into different facilities, but that's not necessarily number one on this. I think we have to look at everything as a whole. So, I mean, I would lean towards probably LaBounty, but I also understand there's a lot of decisions in play here, and the county has to make the best one. So I'm glad it's not all on me, but I'm giving you my 2 cents. Thank you.
Thank you, Raylene. Would anybody else like to speak on this? Scott Cortice, Mayor Cortice.
Yeah, I've brought this up before and I'll bring it up again, but I don't think we can make an educated answer until we know the costs of running this facility and probably the jail. And so it's critical to get cost information, because if it's inordinately costly to run, that will have to define what we can do and want to do, as opposed to just the desire to have it in a specific location. But if it costs as much as some of the other facilities of this type cost, and we have to bear that cost on ourselves, I don't know that that's possible.
Thank you. Anything else on this subject? Kayla, are you looking for anything more than you've gotten here today?
No, I think this is sufficient. Like, I really just wanted in full transparency for everyone to be aware that this decision point is upcoming. So folks know that this is the opportunity for the IPRTF to weigh in as a body if you wish, but it is not required. And yeah, that's all. Just want to make sure everyone understands where we're at.
And we are having a meeting of the FAB in 2 weeks' time to discuss this further.
That's correct. So if IPRTF
Yes.
members are reflecting on this presentation and want their reflections to sort of weigh on Peter and Heather's votes at that upcoming FAB meeting, I would encourage you to reach out to Peter and Heather and talk to them individually.
Yes, please do so.
Thanks. I also, Melora Christensen and Hannah Fisk in our health department have been doing so much work on this, have been visiting other facilities, have a lot of expertise around sort of how the efficiencies and continuity of services flow between behavioral health facilities. So I'm also volunteering them to answer questions if folks need more information to inform them.
I'm anxious to hear all about that.
Okay.
But not today. All right. Thank you very much for that good conversation and making your presentation, Kayla. Heather, would you like to take the next one? Just a time check. We've got a little under an hour. I know number 5 is some good juicy subject, and I would like to encourage as much time as we can take for a conversation around data. But do you want to introduce the next one?
Yeah,
And
I would love
give it
to.
15, 20?
Or even less, honestly.
Okay. All right.
I know I want to first say thank you to Marty and Holly. You both are, I can't say thank you enough. And thank you to everyone on this task force who has weighed in to help us develop an action plan and help focus our intentions and energy together. And so 2025, we had a great action plan, and then we went through a planning cycle through the year, and Marty and Holly took the wisdom from all of you and have offered us a 2026 action plan. I'd love to allow both of you to share anything you'd like to highlight about any of the changes, and then invite anyone, pull it up on your screen if you can, and just take a second to scroll through it. I think it looks amazing. I think it's reflective of the realities of what the focus needs to be for this year. I think there's enough margin for allowing for issues to come up as they need to, and that the focus areas are exactly still the right focus areas. And you all built that. So I just want you to remember that this is from what you've weighed in on. But Marty and Holly, I'd love to invite you to just share any overview or highlights that you want to make sure that we're aware of in the report.
Marty, do you want me to go? And great. Well, first off, it was just great to be able to work on this action plan and just see how we are getting into a rhythm with the planning process. And that just gets more efficient, and it really just supports the productivity of our group. For this one, I'm sorry that the formatting got a little off. So in the final, it won't jump down like it does that. And then the only other thing I want to say is that um, I do think it's really helpful for each committee and the IPRTF as a whole to have those calendars where you plug your priorities into your calendars and then use your calendars as kind of a living tool to help you focus your work. So we've got calendars for all of you already prepped with the key dates that you need to be aware of for like when you have to look at your priorities, when you have to review the reports. So we'll send those to you, and then you can just work with those as your tool to load in your priorities and figure out how you're going to spend your time. So that's it. And any questions you have, or things like, no, you got it wrong, that's not what should be there. Yeah, now's your time to speak up. So any comments you have or questions?
I also want to say that I really appreciate the work that you guys have done and everybody on the committees. It's important and it's helpful for Heather and myself to have this at the ready as we move through the year. So thank you very much.
I'll just make one other comment that I think one of the things we learned in 2025 is that we really do need to start talking about committee priorities earlier, like in September. So, and part of that is because some of the committees don't meet, but like every other month, so if we miss that window, then we're behind the whole year or behind for the whole cycle. So just, I know it's going to feel a little awkward to start talking about priorities for 2027 when you're still in the fall of 26, but just what we learned this year is that it really does help our flow if people can do that. So.
All
Okay.
right, very good.
Good.
Thank you so much. All right, I'm the next item is also going to be a presentation from Holly and Marty, and I just want to thank them for the work that they have been doing that are going to present to you today. It's been a feverish pitch, it seems like, from the sidelines here over the last couple of months of we have a lot of our different groups, committees, work groups working on data, a lot of things going on in the background, and it is now time to start um, uh, aligning all of our efforts. And it's going to be a very exciting time, I think, for data over the next our big data projects, Project 3, over the next few months. So this is, I think, what they have come up with here is an excellent framework. It's moving the ball forward down the field. And I very much appreciate the time and effort they've put into it. And that goes for all the people that they've been reaching out to get information from. So with that, Marty, are you going to give us the presentation?
I will start and then Holly will
Great.
move in.
Please take as much time as, we do have just a few other items, but feel free to take as much time as you need, and let's have a good, robust conversation around this.
All right. Well, what we're going to share is just an update on where we are on developing what we've been calling an interim data dashboard. I'm going to tell you what that is and what it isn't. There we go. So just to get grounded in context here, from the implementation plan, we have this broad goal, a broad strategy, which is to ensure oversight, accountability, and transparency. And Project 3, as Peter just mentioned, is to collect data to measure progress toward desired outcomes and develop a data dashboard. The IPRTF, as you may recall, has 10 goals that are they come from these 15 implementation plan projects. And the second goal is creating a data dashboard to track metrics and data sharing. So that's the impetus here. And who's this? Julia from Village Reach was hired to develop the evaluation and performance measurement plan. In that plan, there were 4 near-term priorities, and there 3 of them are listed here: designating a dedicated role for operationalization of the plan, establishing shared indicator definitions, and conducting SIM mapping, which is going to happen next month. The 4th near-term objective or priority is to operationalize early reporting activities. This was 2 parts. Activate reporting on indicators where there is existing data availability, and build draft public-facing dashboards. So we have been working on building a draft public-facing dashboard. And I just want to tell you how we've been going about this. As Peter said, it has been a pretty fast pace over the last few months, but there's been a lot of thought and intention around the data collection and data dashboards ever since the implementation plan was in the works. So we were not starting from scratch with this. The process we worked out is to contact people who we believe are holding data that's already collected and reported on a regular basis. It's easily accessible, it's reliable, and we wanted the stuff that would be of interest to the public for this first pass. And we drafted summaries and charts. We sent those back to, we got what we could get. We drafted summaries and charts and sent them back to data holders for edits and approvals. And the next step is that we'll send the approved summaries and charts to county staff to post on the IPRTF website. And we're aiming to have all of that happen within this quarter. Well, I'll just move to the next slide and tell you that we really are so grateful to all the people who have helped with this. We have a list here of hopefully most of them. We reached out to these folks because we believed they had data, and they came forth with what they had. And we've been working on trying to make it into something that can be easily presented on a dashboard. This dashboard, I want to just say what it is and isn't. It is going to use these data that are already collected. Some are reports that we got. They were a one-time report. Some are data that are collected over time, like for example, the sheriff's office posts booking data all the time. So we were pulling from different kinds of data that exist, and what we're trying to put up, some of the data that we want to use for this dashboard is already posted, like the booking data I just mentioned, but most of it really is not. And I think that's one of the highest values of what we've been doing right now is we know that there are programs that are doing great stuff and tracking it, but they don't have they haven't put their data up, or maybe don't have a good way of doing that or a place to do that. And this is an attempt to shine light on some of that work. So for that, I think this was a worthwhile activity. We're aiming for simplicity with this dashboard, where a lot of data that is posted regularly is done so on a monthly basis, sometimes quarterly. We've gone through and just consolidated it a little so it's annual. So you can see trends over the year. It's more simple to look at. Much of it is outputs, or it's looking at how much has been done rather than outcomes. And that's like what's the impact on people's lives. That's because of where we are in the process. I think over time there will be more and more outcomes. But right now, a lot of it is more process oriented. So what this dashboard is not, it's not what we hope for in the long run. What I think we all envision is much more sophisticated than what this is going to be. We ideally will have a dashboard that would be able to update automatically by data just feeding into it, and integrating data across the multiple systems. So perhaps you would be able to track an individual anonymously across systems, to see utilization across systems and do that in a way that protected their privacy. And then this dashboard also does not provide a lot in the way of interpretation or explanation. At this point, that's something that could be evolved over time, but we do see this as a temporary kind of tool here. It's an interim tool until a more sophisticated dashboard can come online. What this dashboard does is it lays the foundation for this more refined living dashboard that could measure both performance and outcomes. So I'm going to tell you how it's organized right now. We have a landing page, just orienting people to what they're going to see, and then 7 sections. And I'm going to talk through what's in those sections. On the landing page, we explain, this is, you may recognize this model here. It's the results-based accountability model. And we explain that we are focusing on performance accountability at this point. And that is based on 3 questions. How much are we doing it? How well are we doing it? And is anyone better off? And eventually, over time, we will be ready to measure population accountability. And those population level impacts that we're interested in is, did health improve in Whatcom County? And did safety improve in Whatcom County? And as a result of Justice Project activities and all of the other things that our community is doing to try to address incarceration prevention and reduction and people's health and safety. The landing page also has explains a little symbol that we use throughout with indicators for which there's enough data to track trends over time. We use these symbols, and green is where it's a positive change, and the red is where things are changing in a negative direction. The equal sign is trends. The trend is staying the same. We're not noticing much change. I think I have time to do this. I'm gonna stop sharing this, and I just want to show you what a sample page looks like. Now, are you seeing Lead and Grace at the top here? Okay.
Yes, we are.
Good. And the eventual website won't look like this exactly, but I just wanted to show you how we've laid out content right now, and the kind of format that we've used and tried to be consistent with throughout all of the indicators that we've gathered data or compiled data for. So here's just one that is the number of participants served by Lead and Grace. And at the top of each of the indicator pages, we use this measure, how much are we doing, how well are we doing it, and is anyone better off? and highlight whether the indicator, which question the indicator is addressing. We define the indicator. We say a little bit about why it's important. If we can, we have the trend symbol and we give the source of the data. On some indicators, we have additional notes that provide some interpretation or explanation, further explanation of what you see in the chart. This is a simple chart about numbers served between 2020 and 2023. It's an example, just so you can see the format. And now I'm going to go back to the slides. All right. So oh, hi, Scott. You want to?
Yeah, on the previous slide.
Okay.
I'm confused. The trend is increasing in a positive direction. I guess I understand that means it's a positive trend and it's trending in a positive direction. But I don't
Yeah,
know.
well, it's what we're, you know,
It's the next one though. Trend is decreasing
in a
positive
positive
direction. Yeah,
I'll give you an example. Right. And we realized we needed the colors on this because for example, if we want to see costs go down and they are going down, that's a down arrow, a downward trend, but it's a good thing. If we want to see recidivism go down, like, the number of times people are charged or convicted going down, and it goes down, that's a green arrow going down. Does that help? Okay. Are there any other questions at this point? Okay, I'll keep going. I'm just going to give you a little taste of what is in each of the 7 sections. Raylene?
Sorry, real quick, on the last slide, when we were talking about recidivism and the trend staying the same, are we looking at indicators on the timeframes of when offenses may have happened from when they were actually charged? Because I think that is something that needs to actually be shown in there. And I know this is still in the works, but just curious.
We have some, I'm not sure if I'm fully understanding, but we do have some data that is about like 12 months before a person entered a program and 12 months after they left the program, what happened with charges and convictions in that time period. Can you say your question again if I'm not understanding? Because we may not have any data on what you're.
Yeah, what I'm looking at is sometimes there's investigations and there's stuff that gets sent to prosecutors and it doesn't always get charged right away. So it could have happened a long time ago. There was treatment and then investigations were completed, witnesses come forward. And so you could say that things were on the right track and going in the positive direction, but now he's got all of these new charges that were filed, but was from an incident that happened 2 years ago.
Yeah. We were not the data collectors on any of this. We do have for mental health court, for example, data that we got from their 10-year report that do show it specifies new charges and new convictions post-graduation, 1 year, 3 years, and 5 years. And I don't know the nuances of how they counted those kind of charges like what you're saying, where they were new charges, but they were actually old. I don't know. I don't know how that was done. And to the extent that we can, we've added details explaining what's in the chart, but we also have the data source so people can go back to it and look at it themselves or talk to the person who produced it, because these are going to be snapshots. You know, a data dashboard is kind of more of snapshots, and that's what we've tried to do here, where you can get some information at a glance.
Marty, can you pause for 1 second? Jill, would you promote Dean White to a panelist so he can speak? He had a question or a comment. And while that's happening, Marty, you can just go ahead. Thank you.
Yeah, thanks for noticing, Peter, because I can't see that in there. You are, Dean. Did you want to chime in?
I'm not sure he was promoted yet.
Okay, I want to comment on Raylene's point, which is I think one of the big advantages of the interim data dashboard is we're going to be able to all of us see like, oh, it would be good for us to have more of this or more of that.
Yes.
So I think that's one of the huge benefits we're going to have with this.
I couldn't agree more. And it is Raylene is a font of knowledge and wisdom, as well as so many other people on this call. And I'm just so excited that we have something to pressure test and to be able to talk about. Dean, please go ahead.
I just want to point out that, what Marty and Holly have created is a, a sampling of what could be presented, I think, in this case, particularly to the public, to deal with their interests as taxpayers. I think what Raylene's question goes to is the other uses of data that can be made, particularly by players in the system managing individual cases and understanding the nuances of what is going on in particular cases. And so I think the value of what they've done is to point us to additional questions. And I think that's what makes it wonderful.
Thank you all for those comments, and interrupt me again with more. Okay. Sections 1 and 2 are just links. They're links to existing reports. The first one is progress that's been made on the 15 implementation plan projects. And this is the kind of thing like Kayla presented today. Thank you, Kayla, for that. And the progress tracker and the monthly newsletter. These are all existing reports that are already posted. And progress that's been made on the jail and behavioral care center. We believe there will be more information about that from STV, but right now that's a placeholder. Section 3 is called How Are We Reducing and Preventing Incarceration? And there are examples here of what we have under how much did we do, how well did we do it, and is anyone better off? So I think I won't read through these because I'm feeling self-conscious about time, but I'll just say that the how well did we do it focuses on people's movement through a program and like where they are at the end of their time in a program. Is anybody better off? Is looking at outcomes post-program that are tracked by the program. So for example, emergency medical services usage and jail bookings before and after lead and grace. So it's after the person was no longer being served by the program. And I mentioned this one before, which would have a green downward arrow, cost avoidance. Or it would have a red arrow if it was going the wrong way, if costs were going up for usage and jail bookings before and after lead and grace. So these are examples here of what's in the how are we reducing and preventing incarceration section. The next section is called how are alternatives to incarceration working? And in this, we only have mental health court right now, but we're hoping for recovery court data as well. So what I'm showing you is where we are right now. We definitely are, we have put out feelers and requests for other data that have not come in yet, but we hope to get and just keep building this thing. So with the mental health court data, you can see here what some of the examples of what there is in each part. How much did we do? How well did we do it? And is anybody better off? And section 5 covers changes happening in the court systems. All we've had to go on here so far is a letter from the from Whatcom County District Court judges, and from that we glean, and that letter went to County Council, the JPOP, and Superior Court, and we were able to glean from it new or revised local court procedures or calendars that were implemented and collaborative initiatives or court improvement efforts undertaken. And so those are lists. They are very much process measures. We don't know the outcomes of these efforts. Section 6, who is incarcerated now? Right now, what we're using is the Sheriff's Office jail use reports, which are already posted online. Those reports, what we hope to have is more analysis from the IT department on jail bookings, who's in the jail, how long, for how long, so more details. And so ideally we'll get that soon. The Whatcom Racial Equity Commission report is something we refer to for racial disparities. And then I wanted to just take a moment to share with you this competency evaluation and restoration analysis. It's a part that I'm just really excited about because it directly relates to one of it answers the question of Project 14 in the implementation plan, which is all about making sure that people have competency evaluation and restoration services on time. Thanks to Maya. Thank you, Maya, for connecting us with these great guys at DSHS who deal with this data that is a massive data set. It's publicly available and it covers all the counties and looks at everybody who has been court ordered for an evaluation and then got the evaluation and its dates and outcomes, and then the time between evaluation and when they get a court order for restoration, if that happens, and then when they are admitted for restoration. So they helped us a lot. That's Tom Kinlan and Rusty Horton. Rusty Horton was amazing help. They both are great. And they kind of coached us in how to analyze the data and pull it just for Whatcom County, because what is online is for all counties. And you can look at the data by person or by case number is what it is. But we wanted to summarize it and see if we could answer the questions that are what we're interested in, which is here, I'm going to bring it up right now. Sorry, I got to just find the right one. Here we go. So how long is it taking for people to get an evaluation? And what percentage of people, how long does it take to move from getting an evaluation to restoration? And what is the percent reduction in time between the completion of the evaluation and admission for restoration services. So this all came out of the True Blood decision, and there's a lot of good information about that on the DSHS website, which we link to. I just wanted to show you a chart here because this stuff took a lot of work to analyze, but now that we know how to do it, we're going to get 2025 in there because they just completed December. So now that we know how to do it, we can keep doing it, or somebody can keep doing it anyway. And it's great data, and it's reliable, and it meets all of our criteria. It's reliable, it's accessible, it's going to be collected on an ongoing basis. So this feels like a good one to track. And what you can see here is that 2023 was a rough year. We have average number of days from court order to admission for restoration services. That's just this chart that I'm showing you right now is about restoration services, average and a median. And then in 2024, it came way down, 85% reduction. And now these numbers are within the required timeline for restoration services. So this is fun to have. This is one of 4 charts here, but it's fun to have an answer to specific indicators that we needed to address for one of the implementation plan projects.
Marty,
Yeah.
I would say it's even more than fun. It's what has been required for years and that we have not had. And I got a call from a citizen who gave me an earful about the LEAD program, our LEAD program, because he had heard the LEAD programs in Seattle were not effective. Police were not supporting them. I said, oh gosh, I was just looking at a report that had some very successful indicators around our LEAD program, which is different than the one in Seattle or King County. And then that citizen started asking me questions about it. And it's like, this is exactly what we need to have something like you just showed us so that we can then have people look at it, pressure test it, and ask questions so that we are able to be responsive to citizens and also responsive to the very programs that we are standing up. So I thank you for that. We have maybe 7 more minutes for this, and then we should probably move on.
Okay. So the last section is I'm at the end here and passing to Holly. And the last section is pulling from the Whatcom Health Insights dashboard, which is a beautiful dashboard the health department put together that Julia pointed to for looking at these longer term impacts about did health improve in Whatcom County and did safety improve in Whatcom County. And so we refer to that for the last bit for section 7. And now, Holly, you can just tell me to forward, okay? Since I have the slides up already.
Okay, well, first I actually go back to just the blank what next slide. So I just want to again give a shout out to everybody who helped on this project, especially even over the holidays, and especially to Marty, who's so good at data. And just if you all could see the emails going back and forth between the data collectors and Marty to get clear on things and really make sure it's right. I really like for everybody who's helped on this and for Marty in particular, it was awesome. Just awesome work.
Thank you.
So thank you all. Okay, so I'm going to do some quick, like, what happens next? And Peter, I'm going to suggest we table the discussion. There's some discussion questions, but we wait maybe and table it till February. So completing the data dashboard, JPOP is going to be able to look at everything that we've got so far and give some feedback on content this week. Jill and Jenna, with Riley's help, are going to figure out how the web design layout is going to happen, get it posted as just for internal review. We're all going to get to look at it and just see, okay, how's it going? Anything we need to tweak? And then ideally the interim dashboard will go live at the end by the end of 2026 Q1. And then we'll promote it, right? Share it with the public. Hey, look, there's some really exciting stuff here. And one other thing is that it is so vulnerable for people, I think, to share out data. And it might not all be good news. So I just also want to acknowledge that when we talk about these things, to just have a lot of respect and care and compassion and appreciation for each other, because this stuff is, everybody is doing such an amazing job at cooperating and being open, and that's the attitude that we are going to keep cultivating. So next slide, please. Now, next steps. We have 2 recommendations that went from the IPRTF to County Council and the County Executive's Office. And this is where we're at now, is to follow up. So in July, we put forward the endorsement of the final evaluation and performance measurement plan by Village Reach, and sends a strong recommendation to the County Council and a County Executive to implement and finance the full recommendations outlined in the final pages of this report. And that gets back to those 4 key things that we need to do to move the project forward and in general to get this data dashboard to happen. Next slide. So the second recommendation, and you may recall that the IPRTF data work group recommendation, with a lot of support from Bertie and Dean helping move this forward, is to really be thinking about what we need for this dedicated role. And the recommendation, I'm going to read it because it's super important. It's strongly recommended that the role be structured to operate with a high degree of autonomy and dotted line relationship with the leadership of departments and organizations managing relevant data collection and reporting. The individual must be empowered to engage meaningfully with partners across county, city, and community organizations. To enable this, the position should not be constrained by traditional departmental oversight, but instead be positioned to lead cross-sector coordination, develop shared systems, and build sustainable partnerships. So you all already reviewed this and you put this forward, but right now it's kind of in a holding pattern. So it's picking that back up, and like, how do we get that to move? Next slide. So here's some needs that in this process, like Marty and I came in just for this year. I mean, we're going to continue next year, mostly working with the JPOP, but for this year, we had some room in our contract to really help support this project. But ultimately, we need somebody who's assigned this, who's that dedicated person. So here are the needs from our perspective. So first, someone to ensure that the interim data dashboard is updated and maintained as long as needed. As Marty mentioned, we're still having data is still coming through, right? New years, new info. So somebody's got to be integrating that and kind of be in charge of watching for that. And then this is a quote from Julia's report, right? We need a dedicated full-time position, which is essential to ensure clear leadership, sustained momentum, and successful implementation of the project. Obviously, we need sustained funding for this position. We need focused coordination across multiple agencies, systems, and technical domains. Ultimately, we're going to need to have some data sharing agreements, yada, yada. So that's going to take some time. And then ultimately, the resources overall to create a refined living data dashboard for long-term performance and outcome measurement. And I could go on and on about, and I know I'm preaching to the choir here about why it's important, both for people who are trying to improve the system and for policymakers and for the public at large. So the overall question that we're going to table until February, but for all of you to think about, and you'll have this PowerPoint, of course, to refer back to, is what else do we need? Marty and I have flagged a couple things that seem obvious to us. and how can we meet these needs? If you think about advocacy, like how are we going to, we as the IPRTF going to advocate so we can get this really put into place and take it forward in this next year. So again, thank you all. That's it. That's her presentation. It was really a pleasure to get to work on this, and I think we've really been able to bring something forward.
Thank you so much, Marty and Holly. That was fantastic. I'm so sorry that we don't have time for questions and deep dive, but we will make time on the next calendar for that. And we should rush on to the next items. Oh, Birdie, you can say something, and then you need to go on and give us a report on the index committee. That's the next thing we're going to be doing. So, efficient use of time.
This is short and sweet, but I would just request, since we're going to have the discussion more deeply at our next meeting, that between now and then, would you folks be willing to forward us the comments and input from JPOP? Because I think that would help us incorporate it into our comments when we meet in February instead of operating in silos. So,
yeah, for sure. The JPOP meeting is this Thursday, and of course, everybody is welcome to be there. And today we will be sending the draft content to the members of the JPOP. That will be posted on the JPOP webpage as well. If you want to go there to see content, the draft content, and then the meeting notes, meeting summary, and recording will also be posted. That'll be next week.
Yeah, I just was hoping for kind of maybe the meeting summary will have the details of their comments.
Yes.
You know,
we can extract that.
A million things going on. It would be nice not to have to watch the whole meeting to hear that, because many of us may not be able to do that. And yet I would love to incorporate their comments into our discussion.
Wonderful. Yeah, we can extract that.
No, I'm asking someone to do a lot of extra work. So with apologies and appreciation. So
no problem.
Okay. So index committee index committee report. Well, the index committee met last week, and we did not have a quorum. However, we discussed several things. The most important thing we discussed is that there's clearly a lot of interest and a lot of work going on in multiple arenas across the task force and its subcommittees on data and data definitions. Our index committee said that our work plan for this coming year, number one, was to establish data definitions for an upcoming dashboard. We felt that was something we could do well. And the second was to define better what the quote infrastructure is that we need. Well, between last meeting in December and this meeting, there's a variety of different groups working on the definite data definitions. And so I brought up, how are we going to coordinate? You know, I always find it concerning when we have all these different silos working on the same issues and not communicating well. And out of that discussion came the reality that the index committee meets for an hour every other month. It is made up of a world of expertise in the county IT department, and Caleb, who of course has a world of expertise about the jail, and not a lot of other resources. And there's generally been a concern about increasing its meetings. I made a commitment to Kayla a year plus ago that we wouldn't reduplicate a lot of meetings and add a lot of county people's time. because in that framework a year ago, people were just overwhelmed with all the meetings. So we had a good discussion, I think, without a quorum, and we decided to bring the whole issue and structure of the index committee up to steering committee. The question is, do we exist at all? If we do exist, what is our role? Meeting an hour every other month, regardless of expertise and enthusiasm and whatever else we might be able to muster, is really inadequate for the pace of what's needed for developing this data. And so I will be bringing this up at steering committee. I welcome input from all of you on the IPRTF because we are a subcommittee of you. Caleb used to chair it before I got the lucky role, and he said that he struggled with the same thing during his role as chair. I think the biggest contribution that Index Committee has done was before my time, and Caleb and Perry and others did a lot of work inventorying all the county sources of data and the IT systems used to collect that data. And there's a very thorough map of all of this.
Birdie,
Yeah.
Birdie, so I'm so sorry. I'm wondering if maybe bringing this up to steering is, I need to get on to the other reports and
No
then public
problem. I
comment.
did, yeah,
So,
I didn't
okay, thank you. The next report is Behavioral Health and Legal and Justice Committee joint meeting from December 16th. Dan and Raylene.
Yeah, Raylene, do you want me to start? I'll go ahead and start. So we had a joint meeting on December 16th, as Peter noted. Hold on one second here. I've got two tabs open up here. So I think I want some highlights real quick to pass on to the group. These numbers, the first presentation at the joint meeting was Digwalich, an update on the Flora and Division facilities. I have updated numbers as of this morning from Bed Keys, and I wanted to pass this along to the group. At Division Street, they have 85 patients that they are treating daily, and at Flora, they are up to 40 patients. So 125 total, which I think is pretty significant. The Flora Street facility started up late last year, and the Division Street facility started up very early last year. So we're seeing some increases in numbers, and I think it's reflective of the the opiate use disorder. It's still affecting the community, and thankfully we have this treatment provision to be able to provide for folks. Raylene, did you want to chime in on that at all? Okay.
I think you're doing a fine job. Thank you.
Okay, all right. And the next item was the data work group that was headed, or the presentation was by Cedric Johnson. I don't know if Bertie or Dean want to chime in on that agenda item. They might have more expansive comments than I would. I
I
think
will
that
say that I was in that meeting. It was a good discussion, and I believe that it was there that it was abundantly clear that we need to align all of our data work, and because there's so much good work going on, but it will be stronger if it's all aligned. So I'm going to be addressing this in steering meeting this week.
Okay, great. Thanks, Peter. Appreciate that. And I do agree the discussion was around alignment and how we get that, how we meet that. The fourth and fifth items where I'm going to join those together. They're meeting schedule and agendas for coming up for this year and priorities for committees in 2026. I will say a lot of the items have been covered already today in terms of the Division Street facility and co-locations, and do we make a recommendation on the work facility and things along those lines, or the bounty. So I do want to bring those items back to steering for just a little bit of tweaking and alignment with other subcommittees, or other committees rather, to make sure that we are all moving and put our oars or paddles in the same direction. We're moving consistently. So, and I'll wrap it up there. I know that we're kind of tight for time.
Great, thanks, Dan. Marty or Holly, can you give us 1 minute on J-pop, and then we will do public comment and head out for the day.
I think Tosh is here for that.
Oh, Tasha. Sorry, Tasha.
Okay. Yes, for J-pop, the last meeting was great. It was in person at the WICU Center on Holly Street. We had a robust, Riley gave an update on the event in Ferndale. We had a follow-up discussion on Miriam and the Racial Equity Commission's analysis of the racial disparities in incarceration. And we looked at the SIM model a little bit for upcoming. And then, of course, we talked about the interim data dashboard, which we'll be going into in depth on Thursday. So I encourage everybody to, if you can make it, it'll be a great meeting on Thursday.
Great. Thank you so much, Tasha. I really appreciate that brief report. Okay. Let's see. There's nobody here in the conference room with me. Jill, do you want to call for public comment?
Sure, we do have a number of attendees. If any of you would like to speak to the task force, please virtually raise your hand now. No hands are raised.
All right. Then let's see. I have a question before we adjourn. In our agenda, it looked like there was tentatively a report on the Ann Deacon Center. I didn't see it in our packet, but I'd be very interested in seeing that report.
So I just received that report today during the meeting, and I forwarded it to everyone. It should be in your inboxes.
Fantastic. Okay. In the final 2 minutes, is there any other business that we should be attending to? Thoughts, reflections from anyone? All right, seeing none, we'll close out this meeting today. Thank you so much for taking your time. I very much appreciate it, and so does Heather, I know. And we'll see you next time. Thank you so much.